I'm recording. So, lecture is also recorded. So, Bismillahirrahmanirrahim. Welcome to the MBBS students of the ISRA University, and almost 80, 70 students are online, and almost they are girls. So, once again, my question, popular question, your knowledge before lecture are SDG, and after high, medium, low is the option, and Helsinki Declaration of Research involving human subject is the, as it is uh, agreed or passed or presented by the World Medical Association. So it is an international body of the doctors. So let us move further. Declaration of Helsinki is a cornerstone of ethical framework. In the morning, I also discussed that research without ethics is just a propaganda. It is not a quality research. And when we say ethics, it involves the data, privacy, and many other things. We will declare it. So, ethical framework developed by the World Medical Association (WMA), World Medical in 1964. I think you people might have not been even in this world, and your parents might have born. So, providing guidelines for medical research involving human participation. So, this angle is very important for you because you will go in the research, and human participation is the basic quality of your research. So, what are the guidelines? This is important. Let us move further. I apologize that I am too fast to cover this, and I think you will learn something, and you know that knowledge is just like a growing tree or dropping rains from the sky. So little things sometimes give you a full confidence. So it emphasizes informed consent. Even in the ethical form of the Ethical Research Committee, ISRA, there is a full page with the heading of informed consent. Means without consent you can't deal with the human subject. Second is confidentiality. You will never disclose private, personal, or anything which is very personal and private, whether it is a disease, whether it is a information, whether it is a relationship broken or established, or even certain diseases. They are just like a social stigma, so you will keep it with you. Risk migration means the benefit of your research should be higher than the risk or the damage or the loss of that, and we call it as a beneficence. Means benefit should be higher than the cost. And scientific integrity. So your research should not be purchasable, and your integrity should be beyond question, asserting that well-being of the participant, no harm, no bad thing, nothing. It should be as human as possible. Take precedence over science or society. So well-being is the higher science here. Even sometimes science says that you should have this thing, but if the society and the science both are not supporting you, but for the well-being you have to compromise, and you have to think in terms of ethics, morals, and other things. So let us move further. Key principles. Informed consent I have already discussed, and I will go to the ethical committee review, which your project will be submitted, where at least 5 members are there. 3 are the deans, another one is the religious scholar from the chancellor office. He will discuss the religious aspect. Is there anything against belief system or anything which is against the religion that will not be considered? Ethics committee review. Research must be approved by an independent committee before starting. Please note this, and we are at this point in your research. World Medical Declaration of Helsinki research involving human participation, and before it was called as a human subject also. Duty of the physician who are involved in medical research to protect the life, health, dignity, integrity, autonomy, privacy, and confidentiality. Dignity, utmost respect, autonomy, free will, whether he will accept, he will allow you or not allow, integrity, no false information written or fabricated, privacy, already confidentiality means you have to keep everything within that limits. The possibility of protection of research participant must always rest with physicians or other researchers and never with the research participant, even though they have given consent. Once again, the responsibility for the protection of research participants means the safety of the participant, whether it is a social safety, whether it is integrity, is responsibility of the researcher, not participants. Let us move further as it is. So privacy and confidentiality, this can be a comparison with you. What is the difference between privacy and confidentiality in research involving human subject? That can be question, and that can be short answer question. So every precaution must be taken to protect the privacy of research participants and the confidentiality of their personal information. Here, privacy means there are certain examination tests, their results, and even some documents. These are coming under the privacy. And confidentiality means without the permission of the participants, you are not allowed to share even any authority or anything which is in that. Free and informed consent. Free and informed consent is an essential part and respect for the individual autonomy. Autonomy means freedom. Participation by individual capable of giving informed consent in medical research must be voluntary. It should not be either paid or anything. It should be completely as per the truth and the human values. Although it may be appropriate to consult family members or community representatives who are elder, individual capable of giving informed consent may not be enrolled in research unless they freely agree. Those who will not give consent are not able to do, suppose children and other things are, so you should. Please, आवाज आ रही है? Have your knowledge का कुछ बताएं मुझे. Somebody should tell. It is okay. आवाज नहीं आ रही है?
आ रही है सर.
आ रही है. ठीक है. आई एम अबाउट टू फिनिश प्लीज, क्योंकि जुमा की वजह से मुझे भी जाना है. So this is perhaps the last slide, and you have to keep this record. I will upload this presentation for you also, and I will ask Maham to upload it today or tomorrow so that this record should be. This is unproven intervention is utilized in attempt to restore health or alleviate suffering for an individual patient because approved options are inadequate or ineffective and enrollment in clinical trial is not possible. So this is the only area where unproven research. So we are not in that area, but I think that you can in research a new trial, new drugs, and new things can be researched. But first of all, it is tested on the animals, then it is tested on small groups. We call it stage 1, stage 2, then to the larger group, and then it comes as a proven research vaccine, drug, procedure, or any use of any instrument. Recently, I was seeing the Indian hospital that they have developed a kind of using the instrument to solve the prostate enlargement, and they call it water therapy. So they are injecting water which is warm into the prostate through urethra, through the cystoscope, and this uh, hot water is just reducing the size of the prostate gland because of its action as a heat. It almost reduces to a normal level and then they push back. So it is a day care facility. But this research here in Pakistan will require a kind of trial, kind of training, kind of data, so that we can also implement this. This is the latest, where the prostate incision is gone, where the prostate bleeding is gone, and where the stay in the hospital has gone. And this is almost a painless and just walking procedure. So look at the science is going on, and even the genetic engineering, the design baby is another aspect which is being researched, in which you will have your children according to your wish, whether their color should be this, as well as what they should look like, and design maybe genetic research or genetic engineering is a great ethical question. Test tube baby, artificial insemination, and as well kidney transplantation. These are the ethical questions, whether you will have the research or not. So with this, I think I am ending, and I hope your knowledge has improved after this short presentation. Please, somebody should tell me. जी, कोई मुझे बताए?
Yes, sir. Good.
टीचर जो भी सीआर है, प्लीज एक आप कागज पे अटेंडेंस लिख के, और वो भी मेरे व्हाट्सएप पे या किसी पे आप वो जरूर भेज देना, ताकि मैं फिर डॉक्टर साइना या अपने सिस्टम में। और मंडे को फिजिकली यूनिवर्सिटी खुल रही है, आज नोटिफिकेशन आ गया है, और हमने 7 अप्रैल को वर्ल्ड हेल्थ डे मनाया था। वो यूट्यूब पे भी मौजूद है, लेकिन इसरा की जो वेबसाइट है, फेसबुक है, उस पर मौजूद है, उसको भी देखें। उसमें भी साइंस की बात की गई है और रिसर्च की बात की गई है। थैंक यू वेरी मच, गॉड ब्लेस यू। आज जुम्मे का दिन है, मेरी दुआएं आपके साथ हैं। एनीथिंग which you have not understood, please, we will discuss again and again. And you know that research is an ocean in which you have to move, you have to explore, you have to navigate every day, every time, and knowledge is also just like an ocean. Thank you very much. And in my background, you can see there is an ocean, there is a palm tree that shows that life is beautiful, and knowledge is like a bigger thing like the ocean. Be happy. Thank you very much, please. इसके साथ ही मैं इसको खत्म करा, अभी मीटिंग का टाइम है, बट आई थिंक आई एम एंडिंग दिस। डॉक्टर माहम, आप सुन रही हैं? डॉक्टर माहम, आर यू लिसनिंग? ठीक है, मैं अभी इस मीटिंग को खत्म कर रहा हूँ। थैंक यू।